for today, Dr. Prathap C. Reddy. We would also like to extend a warm welcome to each one of you and appreciate your joining us today. I'm sure most of you would be aware, SICCI has completed 111 years of service to government, industry, and society. During these years, we have had several programs that have been of interest to each of our stakeholders. And during these programs, we have had several esteemed guests joining us and addressing us in their areas of expertise. Invariably, we have found that our guests restrict their addresses to just their area of expertise. We, however, felt that our guests have much more to offer than just their respective expertise areas. We felt that our guests would be able to share more light on their success path, their life's journey, their inputs for the next generation and society. And that's how we came up with the concept of SICCI-360. We have so far held 9 sessions of SICCI-360 month on month since October of 2020 when we started this program. And we are honored to have Dr. Prathap C. Reddy join us for today's event. A few more words about SICCI-360. Bhavani, can you please have the slide? Before I go ahead with this slide that's in front of you, I would like to draw your attention to the names of 2 of our executives listed on the bottom of this slide. Please take a note of their names and numbers. If any of you have any issues in connecting during the course of today's program, please feel free to reach out to them and they'll be glad to assist you. As I was saying earlier, SICCI-360 is a new concept for SICCI, and it's building on the expertise that we have built on our seminars. We wanted to give it a name that depicts a multidimensional perspective because we felt that our guests have certainly multiple dimensions of their life that it will be good to share with our audience. We orient these discussions to be a lively discussion with our eminent guests again who are experts in their fields, who share with us their all-round paths to excellence. We have a stringent criteria before we select our guests. We look for guests who have contributed more than 4 decades of service to both industry, their respective industry, as well as to society at large. This is also an apolitical platform where we want our guests to be able to gain as well as our audience to be able to gain. A few words about the session format that we follow for the SICCI-360 series. The flow of this program is we address 5 different sections. First is we talk about our guests' expertise. Secondly, we talk about our guests' organization and their role within the organization. Third, we talk about our guests' career path. Fourth, we talk about our guests' inputs for the next generation. And finally, we talk about our guests' inputs for society. We certainly encourage you, our audience, to participate along. Please feel free to share your comments on the chat box, and our effective SICCI-360 team would be glad to appropriately feed it into the course of today's program so that it can be addressed. There are 2 guidelines that we follow as part of the SICCI-360 series. First is we would like to make sure that our guest is at comfort at all points of time. This is very, very important to us. And the second is we would like you, our audience, to gain by your participation in this program. So these are the 2 basic guidelines that we follow. With that, I'd like to now share a few words about Dr. Prathap C. Reddy. Dr. Reddy is certainly well known to most of us, but we thought that we'll take this opportunity to share a few words about himself for everybody's knowledge. Bhavani, can you please have the next slide? Dr. Reddy received his Padma Bhushan in 1991, and he was awarded the Padma Vibhushan in 2010. He is an MD, MBBS, FCCP, FICA, and FRCS. He studied at the Stanley Medical College, and before that he was at MCC. He's a trained cardiologist in both the UK as well as the USA. He's the visionary founder chairman of Apollo Hospitals that he established in 1983. Apollo is India's first corporate healthcare provider. Today it has 71 hospitals across our country, 12,000 beds, 3,400 pharmacies, over 90 primary care clinics, 150 diagnostic centers, 110 plus telemedicine centers, and over 15 medical education centers and research foundations. Apollo The Apollo Group has also expanded internationally, both into South Asia as well as the Middle East. Apollo Hospitals has been widely acknowledged as the architect of modern Indian healthcare and has introduced international quality healthcare to our country. Dr. P.C. Reddy introduced the innovative insurance scheme, a rupee 1 a day, which was done decades ago. He has also been actively involved in his charities, three in particular. The first is Saving a Child's Heart Initiative, abbreviated as SICCI. Second is the Society to Aid the Hearing Impaired, abbreviated as SAHI, and the Apollo Hospitals Charitable Trust. Dr. Reddy's incredible journey has been captured through a biography entitled Healer, Dr. Prathap Chandra Reddy and the Transformation of India. This was authored by Pranay Gupta and was published by Penguin. India today has ranked Dr. Reddy as the 48th most powerful person among the top 50 within India during the year 2017. With those few words, I would now like to extend a warm welcome again to Dr. Reddy. Dr. Reddy, a very good evening to you. Thank you very much for joining us.
Good evening, Ram Arun and the members of South India Chamber of Commerce and their family. It's such a pleasure to share with you, to be with you this evening. Because for me, South India Chamber of Commerce is not new. Almost from 50s, I've been following the organization, and I've attended some of their inaugural, some of their important addresses, which people like Rajagopalachari and all have addressed. But I think it's the wonderful work that they have been doing all through the time that I knew, the last 50, 70 years. I think they have done a wonderful work in coordinating the various communities in business to enable them to do better. I think this is the ambition of every one of us. You know, as a child, we want to do better as a child, better in school, better in plays, better with their friendship. As they move on to college, you want to see what next I'm going to be. Am I going to be a businessman? Am I going to be a scientist? Am I going to be a doctor? You know, so on and so forth. This is the ambition that keep building up. I think this is what SICCI is always encouraged. And I'm happy now they have this special program called 360, which is a monthly affair when they're inviting people to express themselves and then see what they can learn from others to think and make ourselves better. But when we say ourselves better, when it is me, my family, and my society. What is it that we can make a difference to all of these? So thank you, Ramarun, and I thank Reddy, who's always been dynamic, to have started this program, monthly program. And I wish all members my very best. I just would like to say, I'm not an unusual person. I come from a small village about 100 miles from here called Aragunda. But it's famous today for two things. One, Hanuman, on the top of the mountain. Hundreds of thousands of people visit that regularly. And we're supposed to have the Shiva, Swambhu Shiva. So I think it's just come through that. It's just then a small village. I still recollect at that time, I couldn't do my studies because we were only up to third standard. So my father would get an English teacher from the Chittor board, about 12 miles from there. He will teach us for 3 hours, Ren and Martin, and 24/7, probably beat our fingers into, without cracking it, we suffer with pain, but we learned. And my education started in Chittor, as a 6th standard. I entered the entrance exam and started my education. So having completed Chittor, then as I said, Lilo College I was there, Christian College I was there. I was in Stanley Medical, where I did medicine. Post that, because normally everyone wants to see what can they do after you finish your doctorate, basic degree of MBBS? Somehow I could not get selected at that time. And the reason that they gave was saying that, it was a community allotment or whatever that was, backward community, service community, so on and so forth. So I was disappointed, and that's good. That disappointment made me saying, now let me see if I can go to UK. I went to UK, worked there for a few months, and also wrote that entry exam into US. Landed in US in 1971. 1970, I'm sorry, 61. 61 in a place called Waltham. It was known as the most small city with maximum number of millionaires. But in any case, I was happy that I was in there. When it came the following year, when they were selecting the chief residents, I was selected, but they belonged to the city. The city said, no, you take a local guy. You don't take an Indian, you take an American. So they did another interview. Again, they selected me. So I think why I'm trying to say this is, it is not the, sometimes when a challenge comes, you must be able to prove what you are. If you prove what you are, I think every one of us has this tremendous amount of inner strength within us. So often whether we feel shy. I could have felt shy saying, oh, American. Those days were probably 100 Indians, not even 100 Indians in Waltham, not even 1,000 in all of Massachusetts. But today, Kalamuthu, I see my good friend Nesimutha, who has been your past president and done wonderful things along with his father. All of these good remembrances come back when I see him. So as I said, this is how I was elected as the chief resident of the college, and then went on and competed to get a place in Mass General Hospital. Mass General Hospital, probably I was the second or third Indian to be selected into Mass General. And first was this great lady, Padmavati, from Delhi. So I did my cardiology fellowship there, and then after some time moved on to Springfield, Missouri, worked at Mount Vernon Chest Institute. But all of this was behind me. I was doing well. I had my children with me. I have 4 daughters. All 4 were born in India, but 2 came first, and then later 2 joined. My parents thought it's too much for us to look after all 4 children in the beginning. But then all 4 joined. I said, so I enjoyed that part of it at home. But I think what was important was I could easily be recognized as one of their best, not because I'm a great individual, because I had that inner desire saying, if I can, I must bring my very best out of it. I will be able to do whatever others can do and probably even do it better. So I became chief president of the institute. They went to Mass General, did my cardiology, and a great person, Kenneth Bird. He was also in the NASA. And I remember him, I said, because way back in 1969, when Apollo landed on the moon, they came to India. I mean, they came back. There was a party 3 weeks later. So we thought we'll take it, and I asked my boss, can I come along with you? So I went there, and fortunately, we couldn't see Neil Armstrong, but they extended their swamp. But what surprised me was, I saw a lot of people there, and I asked one of the directors, I see a lot of Asians here. He said, 51% are Asians, out of that, 49% are Indians. So I think this is where it shows, saying, out in India, out there, their impression about an ordinary Indian was difficult. I remember my children coming back from school almost crying, saying, That day they put on the board, do you sleep on a cot? How many snakes go, go around on you? And all sorts of things. This is the impression. But I'm happy that these doctors and these scientists went there and made a big difference of what really an Indian was. But the credibility, although I should also have that credibility I didn't have, the true real credibility came to India because of the IT people. IT people made India proud so that we could lift our heads. So when looking down, when somebody is talking, you can look up in India. And India also promoted their virtues. So I think this is where I just wanted to say my career. Then when I was doing well, I suddenly got a letter. I used to get a letter from my father, probably written by his agent. Once I had a letter from him saying, I know whenever I buy a new car, I used to put my children on top and send it. Instead of his expressing his joy over that, he wrote very nicely saying, whatever you're doing, I know you are all happy, the family is happy, the country probably is benefited. If you can do something back for our people, how will that be? So I think message was very clear. It's not say come back. I looked at my wife and she said, yes, I think it's time for us to go. Fortunately, all my 4 daughters, they probably, I don't know if they were living now. At that time, they were all below 12. None of them resisted. And in a few months, we were back home. And it was not easy coming back, seeing absolutely nothing in India. But I joined a new private hospital, HM hospital started. I started there, brought the entire facilities what a cardiology could have. So many patients, both from within India, from outside, they were all my patients. And what I could tell them was that sometimes if the medicines cannot work, we need to do surgery those days. Unfortunately, there was no acceptable surgical program in the country. So I used to send my patients, N.T. Ramarao went, President Nani said, I sent so many people. Fortunately, I recommended a young 38-year-old sent to, referred to my dear. I used to send most often to Dr. Denton Cooley, who was a personal friend of mine, and or to sometime to London to Dr. Fraser. But in this instance, the surgery was supposed to be in October. On November 9th, he died. December 9th, he died. You know why? Could afford to raise the $50,000 to go to US. Seeing his wife, who was only a 31-year-old, 40-year-old daughter, 2-year-old son, I almost got flabbergasted. How many more are going to die because they can't raise this money? Why should they? If you go to any institute, even then in Dr. Denton Cooley, at least 10% for first-class Indian doctors, the cardiologists, the cardiothoracic surgeons, the anesthesiologists, everything possible. I said, if an Indian can do it overseas, why can't we do it back here? So I got this idea. But then to get it, at that time, healthcare was not considered as anything. Healthcare, it's a commercial thing. Even the custom duty exemption, duty for medical equipment was 360 degrees because it was called a luxury item. There's no question of banks or any institutions giving any loan. I said the only way, they said the local government said they can do nothing. But when I went to Delhi, that was my second trip. I think I went first trip as a visitor when I was a student. After coming back, I was so busy, I never went to Delhi. So I went there, not knowing anybody. I think that my purpose was very clear, that I must. Everybody said, unless you meet the number one lady, the Prime Minister, you don't think it will happen. So I tried to one of those Dharma darsans, then met some of our local general secretary. They all supported me. So the third time she said, I believe you want to talk to me. So I told her, I said yes. Then she called me, and then during the discussion, I said, why Indians cannot have good health care. And it is the priority of a small percentage of people, the rest of the people are suffering. And we have the capability to do it. So anyway, after some time, she called the principal secretary, and he listened to the whole story. Then to the health secretary, and then business started. First thing they made 360 degrees as zero with a social commitment. Second thing was there were elections, and around minister became head, finance minister, and then he told me after several trips, yes, I will get it done this week. You meet me, and I come to Madras and Raj Bhavan. I met him in the Raj Bhavan. His face was pale. I said, Dr. Reddy, I can't do it because I believe I'll be impeached because if healthcare is given this loan. So fortunately for me, he went into defense, and Dr. Prathap Mukherjee came into defense. After second time, he told the Secretary of Finance, saying, if you don't do this, you are going to prove that I'm an inefficient finance minister of India. He said, what, sir? I said, look, this concept is liked very much by the Prime Minister. If I don't do it, he'll go there. If she does it, that means I'm a useless finance minister of India. I think that was how it started. And first, they gave us a loan only for Chennai. And seeing Chennai, practically in Chennai, it was no longer belong to Chennai people. People used to say, Sardarji is a failure hospital because of heart. They had the maximum heart disease. So, in any case, Chennai hospital proved that India and in India, you can get the best of care. First, we started with heart because there was a cardiologist, but simultaneously we started everything. I still recollect, I think all of you must remember, when I first started, the 3 days before inauguration, then President Narendra Singh came to inaugurate the hospital. 3 days before I called, we had about 870 employees, doctors, nurses, technologists, various people that are needed in the hospital. I told each one of them, you all come from different schools, different classes, different religions, different professions. But today, we are one. We are a full of family members. Our one intention is that we will live up to the expectations of people who walk in. They walk into the hospital saying that they will get better. So I think this will be our primary purpose. This is how I think that tradition is still carried on. But I have 4 wonderful daughters who later joined almost without job, without salary. They work hard and they added towards the care and compassion. So my first daughter named it a tender loving care. This tender loving care. So today, as we have more and more hospitals, we really, in India, Apollo is known for 4 things, 4 C's, clinical competence. In every single discipline, we are as good as the rest of the world. First, I'm happy as a cardiologist. I started with cardiology. We were somewhere along the line, among the top. In the last 4 years, we are number 1 in the world. We've done 190,000 coronary artery surgeries, and our outcomes are better than Cleveland Clinic. The Cleveland Clinic outcomes is 99.1, 99.2. Ours is 99.4. Our Our 1 year survivals again is above 90%. Nowhere in the world, 1 year survivals are above. So I think starting with that. Later on, I remember 6 years ago, when I went to Mayo, the CEO gave me a bunch of flowers and said, Dr. Reddy, this is for you for overtaking on transplants. You know, the transplants also, I brought that act because the act was not there in India. So I brought the entire literature, people were going on and on. One day they called the parliament session to impeach session. And the minister told me, Reddy, we don't have majority to impeach him. The 2/3 majority they should have. So I said, why don't you pass this bill since you have all the members? Then let's go to the Prime Minister. So Narasimha was the Prime Minister. Immediately he said, yes, I said, I promised Dr. Reddy. Even in US, he made me promise before in Washington, before the Indian session. So let's pass that. So how the bill was passed. But unfortunately, there was no teeth to it. So I must thank Madras government. And they brought in saying the doctor who is in charge can take steps. The steps were that like you do an ECG, the ECG stops, the heart stops. So like that, if they do a brainwave, you know, what we call EEG, electroencephalogram. If encephalogram is flat, you can say he's brain dead because he is already on supportive treatment for heart with the IV and ventilation. All his organs are still fresh. So we can take this organ. That's how the first multi-organ transplant took place in India, in Chennai. We had the heart, the lung, the kidneys transplant. So that's how the transplant program came. But thanks to the Polo family members, they made us #1 in the world. We continue that leadership in almost every single organ that we do. When anybody does brain, we hope we won't be the first, I know. But if anybody does a brain transplant, probably India also will do. And I hope it will be Apollo or Apollo, any other Apollo family members who have done this. So I think this is where it is. It is not me who have achieved all of this today. Whatever we are today, I think we can proudly say Indian healthcare today is probably one of the best anywhere in the world. Simple example, in cardiology we have done everything, in transplants we have done, in orthopedics we have the best doctors possible because they have the same backup services that are available for them. It is, #1 is people, the trained people who support them in their surgery. It is not surgeon success, it is the team success. And they need all the supportive automation that is required for them. So all of these people never hesitate. I have never ever bought a second-hand equipment because it is for another human life. Will I use it on me? Will I use it on my parents? I think this is where I think we made a difference. This is the attitude which every single member of our family had. It should be good enough for me. It should be good enough for my family if I use it for my. So almost
Thank you very much for those words. So very, very detailed statement of how Apollo started and the challenges that you've had. I'm glad to share, Dr. Reddy, that of course you noticed our President Emeritus, Dr. A.C. Muthaiah on the call, but also wanted to tell you that we also have Dr. Meena Muthaiah on, and we also have a person who's well known to you for several decades, SRMS Narayanan Chettiar. And we also have 2 other doctors. One is Dr. Prasad Shetty, who's a gynecologist from Australia, joining us today, even though it's quite late for him. And we also have Dr. Jaybalan from the UK. He's a senior orthopedic surgeon as well, joining us. Dr. Reddy, wanted to ask you, must say that Apollo Hospitals has been, sorry, Dr. Reddy?
I said first, I'm so happy that they're all there. So Kumar and I know Kumar Raja was also FICCI chairman. Muthu was there. Muthu's father was Chidambaram was SICCI chairman. I mean, SICCI chairman. So all this, it's so happy that I'm having my old friends and people
Yes.
you know and with reputation are also on the.
Dr. Reddy must say that Apollo Hospitals has been at the forefront of our country's fight against COVID. And we certainly have to appreciate everybody at Apollo Hospitals. And we would like to take this opportunity to greatly thank each of our frontline workers in our country in our fight against COVID. Can we request you, Dr. Reddy, for your comments on what our learnings have been from COVID, as well as the current situation today? And most importantly, what's going to be what we should look forward to in the coming future towards our fight against COVID?
I think, this is some healthcare crisis which we have never seen in our lifetime. For the last 100 years, I think what was frightening when we were all small, young, was smallpox. And smallpox killed a few people, but it was not a universal disease. Then came polio. Polio, I'm happy in India conquered, but nothing like we're presently going through this COVID-19. Completely shattered because people became panic. The disease was spreading from to the nook and corners. My village is a remote village. Even that village had 100 cases. I think this is where people were so scared of the disease, and then the hospitals have to rise up. It is the duty of the doctor to give his very best to do this. I must commend the entire world, the healthcare personnel made a great contribution. They sacrificed themselves. We know some of our doctors. I lost one of the top neurologists in my hospital because he was going every day, 4 or 5 times into the COVID ward to look after the patients. So I think the doctors, the nurses, the paramedics, right from managing director to our watchmen, each one of them, our pharmacists. I lost a few pharmacists who were delivering medicines during lockdown, taking medicines and delivering it at home. So all of them need our appreciation, our prayers for them and for their families for the great contributions that they have done. So what is this COVID? We know corona viruses. Somehow it got altered. There's a question how it got altered, but we'll not go into politics of that. But we know now that the disease is a very virulent one because it is constantly mutating. And the mutation now, what is the mutation that is occurring? It translates faster than before. If suppose 100 people were exposed to one patient, previously 10 people were probably got infected. Today, almost 90 people are getting infected with it because the infect various of the variant has become very severe. So I'm happy that India managed the first crisis fairly well. And our inefficiency and our unpreparedness taught us a few lessons during the COVID-2 time. And even oxygen was not available, and probably several deaths were occurred for lack of facilities. I'm glad that the government today have realized that possibility and hope. Number one, to contain the third and fourth Japan Sea, they're having Olympics, but there is no visitor there. Even the running itself is going to be different because they're getting infected, the players or the people are getting. So I think it's a highly infectious disease, COVID, which we have never ever dreamt in healthcare history so far. So I think what is needed is for people to know that COVID, you must take every single precaution. 3 things they have taught, which from the day one. You all have followed that for the 3 principles. That is, wear a mask, wash your hands properly, and don't, come in contact with people. If these three things were observed, the disease would have been little lesser. And then we went on with our elections, we went on with our religious festivals, we went on violating how big we are, the whether should be the function. So I think all of this has harmed the world, and the world is paying the price for it. And India is so sorry for all those people died for want of oxygen. Simple oxygen probably could have saved them. So while the country is preparing itself, and I must say, all of us must pay our tribute to the entire medical profession. But if they have taken the precautions, I give you one small study that we have completed. We completed in Delhi. We have 3,905 employees there. All were vaccinated. Only 0.05% had the infection. And none of them needed to go into the intensive care units. But those who had non-communicable disease along with it, that is another 0.01% to go into intensive care units, and some of them, a few of them could not even save. So I think what is important is, number one is to take all precautions for COVID-19, so that now it's a quickly younger generation. So I think the greater and greater steps that need to be taken. Immunization, unfortunately, they made so many mistakes. Apollo has offered. One of my grandsons built a whole program so that we can do 1 million vaccines a day. And the government was shocked. He said, no, if Apollo does, what happens to the government's credibility? So anyway, that they didn't allow us. But whatever vaccine that we have coordinated with so many communities, and certainly the corporates have given the vaccination. We continue to do what is that the thing is, we don't have adequate vaccine given to us. So many policies, and we are allowed to import. Once we import, we need to vaccinate as many people as possible. So I think that is a very critical disease. We have not got over it. All that we need is we need to be much more careful, take greater steps to control the disease pattern. Along with
Dr. In our fight against COVID, we've noticed that there have been a few areas, like you rightfully said, oxygen has been one area. There have been a few areas that we've not been as prepared as what we should have been. Do you feel we have since plugged all the gaps? If not, do you feel that we should be doing more, and what should it be?
I think the three components. I think Apollo is the first one, which we did what called Kavach. Apollo COVID Kavach. COVID Kavach is first, we had a 24/7. Hope all of you have used it. We prepared 24/7 so that people can contact their doctors if they have any symptoms, what they should do. If they need any medical device or medical drug to get this. For that, we prepared this 24/7. Fortunately, it came on time. They answered more than 35 million people have contacted with the fear saying, do I have COVID? So our doctors, 6,000 odd doctors, participated in this, giving them advice, saying, you have no these symptoms, don't refer to COVID. If it is, then they told me, you go to such and such a place, get a test done. And then whenever they needed medicines, as I said, our pharmacies across the country could deliver to as many homes as possible the medicines that are required. So we did admit all the patients that came to us. I think we have treated one of the largest numbers of patients, over 36 lakhs of patients. But these patients, we had 5,000 hotel rooms across the country. Wherever our hospitals were there, we also have put it. And when their symptoms were not severe, we kept them in the hotel. Our housekeeping team, our nurses, and our doctors on video call answered their problem. And 1 out of 20 needed their symptoms aggravated, they needed hospitalization. So then we brought them into the hospital. In the hospital, again, there were two categories. One is non-intensive care and intensive care. And then, of course, then we added what is called the third one called the ECMO in serious patients to support them. They're all their heart to support their heart in severe conditions. So I think these are all the various steps the country has taken. I'm talking about Apollo, but I'm telling you this is the great contribution. Public healthcare system, private healthcare system built themselves up. Especially the public healthcare system were not aware. They did not even have enough material. Fortunately, country could allow gifts to be given, so on and so forth. So I think we are now really ready as far as the healthcare and hospitals are concerned. But I think we still need to change the mindset of people. Mindset of people is saying, I can get immunity by getting exposed. That's a wrong attitude. Get immunity by exposure and not get the disease, you are fortunate. But why should you depend upon the fortune? You're not an astrologer. I think you, as an individual, you must be careful and to see. And we're pushing the government. I hope they will be able to stand up to the pressure of vaccination. That our state is slightly better than some other states who don't have this percentage of vaccination. Unless we vaccinate at least 50% of our people, the country is not going to be safe. This is not a disease of today and tomorrow. The third wave, fourth wave is different. This is like all other viral infections, which is dengue fever, which is coming frequently. Like this, I think this is going to be an annual feature. So this is where I think the immunity will make a significant difference. The second question was, there was a lot of talk about the vaccine. That vaccine is 90% effective, this vaccine is 70% or 80% effective. First, you must remember, first it's effective for you to give you protection. What percentage of protection that you need is not mathematics. I think this is the human body, which whatever the help that you can give to it, you can give. Now then we now got this latest drug called the Regeneron. What is Regeneron? Regeneron is antibodies, which if you have taken the vaccine, it will produce the antibodies. These antibodies are readily given to you. If you are given in the first 2 or 3 days, probably the disease will not progress. And the patients are being able to being discharged on the second day, third day, or even second day, with total assurance that if they take a few steps at home, for the next 10 days, they will be all right. So I think all these are happening. Still, I think there is that huge effort that everyone should, every government should make it. And unfortunately, the media must give the uniform message, not talk about effectiveness of a vaccine or the side effects of a vaccine. The side effects take place in 1 in 400,000 people. Should you be bothered about the side effect? Then you can save the rest of the people. So that is what so many feared and did not take the vaccine. When vaccine was given free, at that time people did not come to take it. So I think that's a good way. I must also say, when you talked about the 21 to 30 was projected by World Economic Forum and the WHO, saying this is going to be a very difficult decade in healthcare because we will have what's called the non-communicable disease. Non-communicable disease which will affect 80% of the population. What are non-communicable diseases? diabetes, heart problems, strokes, cancer, infections. They said these five, and I'm now adding two more to it. Sixth one is the obesity. In India, we think we are not obese, but by number wise, we are increased. Percentage wise, we are not obese, but per number wise, there are a lot of obese people. Obesity and mental disorders. So I think for these, this century, 80% of the deaths by end of the 2030, they say this is what we are going to see. The cost burden of this is, for the world, it's going to cost $30 trillion. For India, it's going to be $3.8 trillion, which is almost going to be 50% of the GDP. I've tried so many times with all the finance ministers, the health ministers, the planning commission, the prime ministers, to increase our GDP for healthcare to 3%, to 5%. But they are still struggling around that 1%. Increasing it by 1.1%, 1.2% is a great thing. Like a big announcement they make. They make it in crores of rupees. They forget that it is adding only to 1.2 to 1.25% of the healthcare. But what we need is minimum 3 to 5% of health government expenditure, and the public should spend 5 to 7%. Everyone should get insured. There's a small price to pay for an insurance. So I think if you the next big challenge that we have, even after get over COVID, after even bring it under manageable stage, we are going to still face these non-communicable diseases. Heart attacks in India, I remember in 1974 in American College of Cardiology, I said Indians get heart attack at a young age. They laughed at me and said, Dr. Reddy, Indians don't know the end of birth, date of birth. I said, don't be foolish. They not only the date of birth, they know the star in which they're born. Now we know there was probably a famine some few hundred years ago. At that time, for Asians, the gene altered. Now we know the 10 causes of, they used to say coconut was the worst. I said, no. Kerala is not only coconut, they rub all over their body, they don't get increased heart attack. Ghee is not responsible. So we know the 10 risk factors that are available. These 10 risk factors are easily controllable. If you control it, you will not get heart attack at 30s, you will not get at 40s, when you are very important for you and your family. To prevent a death in a household when you are 30 and 40, it's a terrible thing for them, for their family, and to the country, even our GDP growth. I tried all of these with the government, somehow I could not succeed. I hope you as president of SICCI also take this up to the organization. CI has done it, FICCI has done it, but still the government somehow, healthcare still is seen not only by government, unfortunately the media has made it as saying commercial. It is not commercial.
In fact, as you rightfully said in the past, Dr. Reddy, non-communicable diseases, that forms 53% of total deaths in India, which is a very large percentage, which is much perhaps higher than COVID. So completely agree with what you're talking about. If you might permit, I'd like to invite Dr. Jayabalan from the UK. As I said earlier, he's an orthopedic surgeon in London. Dr. Jayabalan, can I request you to please go ahead with your query?
Hi, Dr. Jayabalan.
You'll have to unmute yourself, Doctor. Can you please unmute yourself? We cannot hear you. Bhavani, has he been unmuted?
Sir, I'm requesting him to unmute, sir. So I'm giving him the access. So you can unmute now, sir.
There should be a window on your screen, Dr. Jayabalan, asking you to unmute.
Can you hear me now?
Yes, definitely. Please go ahead.
I consider it truly a great privilege to attend this discussion, a great interviewer and equally great and distinguished interviewee. Dr. Reddy, I met you in UK many years ago. I am an orthopedic surgeon practicing around. I am an orthopedic surgeon practicing around London area about 45 years. Unlike you, the best, I have settled as one of the best here. And you were stating that you are strongly advising us to come back to India. I fully agree with you, but at present state, India seems to have arrived to UK. We have got an Indian finance minister, Indian health minister, Indian home minister. So things seems to be changing in that aspect. You have single-handedly, it is not an exaggeration, put India on the World Health projects and map. India, I think India and Indians should be very fortunate for your efforts. It's not an easy effort. My question is, you are in a very privileged position, very strong position, but I'm going to digress with what you have been discussing now. I am talking about the doctors practicing in India. In UK, I know you know very well, I just repeat, in UK, even in a remote corner, a small village, you go for a medical consultation with a specialist, he or she would have gone through a rigorous training program, postgraduate qualification, accreditation. The concerned royal colleges recognize them, and then only they go into the General Medical Council register. So wherever you go, you see a uniformity in the quality of medicine, care. I know Apollo Hospital thoroughly vets its specialists. That is why you are leading in India. It is not just a luck. That is how you are reaching the top in the world, I must say. Whereas if you go to other places, I may go and consult somebody. He has got absolutely just he could have finished his MBBS. He would be equally operating just like any other specialist who has gone through the rigorous training, postgraduate qualification. But
Doctor, sorry to interrupt, can I request you to please come to the question soon so that we can...
Question is, how are you going to get these doctors standardized? Is there anything you can do?
I think it's a wonderful question that he asked. I think there are two things that I would have wanted to cover, what's called the future of Apollo. But the necessity in India today is, we have repeatedly pointed out that we need to add 100,000 hospital beds every year. We need to double our doctors, we need to triple our nurses, we need to quadruple our paramedics. What is the advantage for this? Number one, India still needs 1 million healthcare people each year now. There is a gap today in India, and then the world needs it. You know, today, if you have enough colleges, enough training, and given not the same, you know, where our medical students are still studying what we studied 60 years ago. I think what they need is today's healthcare, health education. If it changes, they will be required anywhere in the world. So I think it not only IT, India could make us feel proud by providing healthcare for the world, because our outcomes here are the same as everybody. You know, I remember when we opened the Proton Institute in Madras for cancer. It's as good as any place anywhere in the world. One patient who was in Mayo Clinic, having paid $180,000, having seen our IT, spoken to our doctor, came back and got care. And he said, Dr. Reddy, your hospital is better than the best center anywhere. So I think this is not Apollo. This is what Indian healthcare institutions, these quaternary, tertiary and quaternary institutions, they could be of great benefit. But I think government should now allowed, it would have costed them nothing. I have a model in Chittoor. I have a hospital, district hospital I've taken for a medical college. It was 300 beds with 100 outpatients a day. Today it's 900 beds with 3,000 outpatients a day. What is the benefit? It is giving good background for our doctors, nurses, paramedics, pharmacists, for all of them to have sufficient clinical material to give. So if they make the district hospitals, to discuss in the parliament, nothing happened. I spoke to the last health minister, nothing happened. If they have allowed 60 colleges to come up, there will be good health care for that district, number one. Number two, there will be more doctors. Our postgrad studies, they should double the number of postgraduates. Why should they go abroad? People from outside should come here because we have our teachers everywhere, are doing outstandingly well. So I think what we need is to change the attitude. The second thing I wanted to say is the future of Apollo. I'll finish with one. The future of Apollo healthcare is there are 4 things which are going to change. One is artificial intelligence. The second is automation. Third is robotics. Fourth is 3D printing. Artificial intelligence, already we have appointed body. Hopefully by September, one of our hospitals, that's going to be the Chennai hospital, will have as good as the best center anywhere in the world as far as artificial intelligence is concerned. What it does is it improves the efficiency of each system that we do, starting from the diagnostic, starting from in the theaters outcomes, in all of these. Second is automation. Automation is will make a significant impact in giving 100% efficiency to the whatever it is doing. Robotics, yes, still we are very short. We are the only one who have about 10 or 12 robots. Hopefully we'll have 1,000 robots in the country, which will make surgeries much more accessible, more safer, lesser time in the hospital, and better outcomes for the patients. So they can go back home on the second and third day after robotic surgery. So we're doing robots for general robot, we have the spine robot, we have now got the brain robot. So I think last one is CD printing. CD printing is, I don't know when, we have a small initiative going on in Hyderabad, but the first heart, I think, is Reddy in Kansas. I want to see how that's going to work. I hope in India, we will develop the CD printing, which will make a significant impact because there are a lot of people who need this. So I think the future of Apollo is going to change, future of healthcare is going to completely transform. We need to be there. We need our government to help us, but more than that, our organizations all should push for this type of change so that India could become global healthcare destination. As I told you, there are 4 things which are the criteria. Clinical excellence, we are second to none. In orthopedics, I'm sure he's doing whatever is being done in London, is being done here. Similarly, in everything that's possible, we're able to clinical. The 2 things which you can't buy, it's a Jewish market $1 is care and compassion. And finally, our costs, they're only pushing the cost down. It's a question of life. Heart surgery, when we used to do a $4 against $6,000, now they say you do it for $80,000. But you pay your people more. So I think all of this is right, you sit together and then they all agree, which I could not do with the Planning Commission and the ministries, which I hope the organizations will change. I assure you, India can and will in the next, 2 years could be the same. And again, India is the only one which has got these young people, 40%, the school age, college age, they could be trained into healthcare professions, multiple professions. We have 14 divisions in healthcare today. Each one of these can absorb a lot of people and train them in various healthcare professions. And India can then give it to the rest of the world. then it will compete with IT in your income. Direct income, indirect income. The remittances will increase. People will come to India. As I said, when I opened my proton, in the first 100, 41 patients were from abroad. Unfortunately, COVID came. I'm finding it very difficult. Probably, once this is over, again it will see that light. And it's not just in cancer. In probably in everything else, they will come to India because they have recognized our clinical excellence. Our doctors are good. Our medical teams are good. Our costs are low. Care compassion. Along with it, they could also go and do the naturopathies. I'm very much for it. Get well. Let him spend another 15 days and get other systems right. So I think India has a great chance to become number one in the world in healthcare. And
Thank you, Dr. Reddy, as well as thank you, Dr. Jaybalan. Dr. Reddy, if I can now request our second speaker from the audience. He definitely plays a role in SICCI as well as in Apollo. This is Dr. V. Balaji, who's heading SICCI's Healthcare Committee. Dr. Balaji, can I request you to please go ahead?
please.
Namaste, sir. Firstly, on behalf of myself and so many of my colleagues, I would extend my sincere grateful thanks to you for providing opportunities to me and so many of my colleagues who come from overseas training to provide best of healthcare to our own fellow countrymen. That is what we wanted to do, and thank you so much, sir, for giving me us the opportunity. My question to you is about the next generation. I mean by that, what is your advice to next generation of doctors who are coming up, both in the term clinical excellence, as well as like your success story, how to develop healthcare delivery system to make it best in India?
I think Dr. Balaji, you already said that you have brought in the best technology and given it to your associates. Like for example, I don't know, Apollo alone has trained over 30 cardiac thoracic surgeons of equal importance. They're working with us, they're working outside the country and everywhere. I think what is very important is that it is possible that we create institutions for excellence. In each of these institutions, yes, we have the primary and secondary care institution, which will take care of the 90% of the patient load. They come to the other 10 called the tertiary and quaternary care institution. This will not only bring the latest in technologies, latest in adaptation of technology, but in training people. So the medical colleges trainings also should become associated, integrated with the hospital so closely. So the students, even from the student days, will have an aspiration saying, I know I'm choosing the right division post-graduation when I do that. So I think, Balaji, what you said is, my advice is very simple. My advice is, give an opportunity and Indians will see top of the line in healthcare. And we need focus on people, allow them to bring out the very best in them.
Thank you, Dr. Reddy. I just realized that it's about an hour since we started talking, and
one word on philanthropy. I think previously healthcare profession was considered as a profession which was giving people and doing service. We also know now, doing what's called corporate hospital, we are also in a lot of philanthropy. I give a small example of many things that we do across the country. I still recollect today, two old people home insisted on sending us messages and talking to me of how well they are being looked after during that past 1.5 years by Apollo philanthropy team. I have adopted one mandal in Chittoor with 60,000 people. We look after from the first breath to the last breath. This first breath to the last breath, that means before the child is born, take care of the mother, give her 2 meals a day, take care of all the diabetes, sugar, whatever lacking she is, correct her, deliveries are done with her. It used to be the highest infant neonatal mortality, Chittor district. In this bundle, it is 0 last 4 years. The second thing is, as they are screened year after year and the data is in the cloud, we're able to eliminate and correct the diabetes, their sugars. Most importantly, last 2 years we diagnosed 19 cancers, 11 in men, 11 in women, 9 in women. All corrected because they're all cured because they're diagnosed stage 1, stage 2. I think this is the second. The third, we take care of the older generation and see, we've done about 350 knee transplants in a village hospital with no infection. This is why my doctors, Dr. Madhavan Reddy and his team, they go and the anesthetic team go there every alternate week, do 5-10 cases. They have completed now 350. It's so wonderful to hear the old people to say, my grandchildren used to tease me before, today I can chase them. So I think this is the pleasure that I get. And finally, yoga and meditation. Now we have started an Ayurveda Institute. So I think we need to bring all of these. That is not just what we call a corporate hospital, but I think health community as such is part of the society. If we both accept each other in that line, I think we can do many more things in the country. I'm proud that I chose doctorate, but it is not me. It is each and every one of the 114,000 people. Again, I want to tell one more thing in this. Fearing this non-communicable diseases, I passed in the board passed saying every 112,000 Apollo members, their families, and their adult children will get a free health check from us. We found what's using artificial intelligence, we found what's called a Pro Health. This Pro Health detects, if I take blood from 10 people, it won't do the same test for them. According to their history and doctor's guidance, it do exactly to point out what problem he has got. And also he has a data which is now available, and I talked to you about the 24/7. Already it has touched 30 million. My intention is that it will touch at least 300 million Indians and at least 3 billion people across the world. We're going to take it to the world probably next year. This year, we're trying to expand it for the betterment of people in India. Any doubts that they have, we also give free cancer advice for people. Free COVID advice on certain hours. It is free. Anybody can get advice from one of our specialists. So all of these things are possible. I think we need to use it. To be able to use it, we must understand each other and admire each other's work. We must admire the industrialists for the great work that they're doing, for the great work they're producing, the amount of service that they're giving, the number of jobs that they're giving. All of it, I think we should be a total individual. This is what I.
Dr. Reddy, we would also like to accommodate a question from another doctor, Dr. R. Sudha. She is the principal of the MAC Nursing College in Chennai. If I might request her to kindly go ahead. Dr. Sudha, are you online?
Sudha?
Dr. Sudha, are you online? Yes, maybe we've not been able to get her. Moving on to the next
topic. Nurses, I want to give a message on their International Nursing Day, 200 years after Nursing Day. We promised saying that we'll upgrade all nurses. It's a promise that we have taken that of at least 30,000 nurses will upgrade them from their position from staff nurses to higher and higher position, so that their incomes will be better, their life will be better, their usefulness will be better for the healthcare. So this is what we have done. Appreciation of their services for COVID. Apollo has taken this pledge, and we have so many other institutions have joined up in trying to do this. So this is a message for she can pass on to all the nursing colleges.
Thank you very much, Dr. Reddy. We told you that 1 hour discussion, but we've gone much ahead. We have to be able to appreciate the time that you've spent with us. Thank you very, very much.
Thank you, and thank you very much, and congrats for what all you're doing and your predecessors, and to Aruna, my special congrats. She's a wonderful girl. What she is doing with you in making this happen, I think I admire.
Dr. Reddy, as a continuation of the SICCI-360 program, we would like our guests to autograph their photographs. So we would, of course, if it was an in-person session, we would have requested you to do it during the session. But because it's online, we will, as much as we've shown the photograph here, we will send it to you. And we request you to please autograph it and also affix today's date and send it to us so that we can make it part of our memorabilia.
Also, next technology will be from here I can do.
Also, as a continuation of our appreciation, Dr. Reddy, we would like to hand over a memento. As new as the SICCI-360 is, even the way that we recognize our guests is very new. I'm sure that you're aware of the Sri Kanchi Kamakoti Child's Trust Hospital in Nungumbakam. What we have done is we have donated in your name for the expenditure of a child from an underprivileged family. This is a new area that we've started within SICCI-360, and we are glad that this is of good value to society as well. We will have this certificate sent to you at the earliest, Dr. Reddy. We wanted to also share that with you. Also, friends, I would like to take this opportunity to thank for today's session Dr. A.C. Muthaya, President Emeritus of SICCI, and I would also like to thank our event sponsor, Sri City. Before closing, I would also like to take this opportunity to appreciate the efforts of the SICCI-360 committee. It is led by Mrs. Valli Arun, who is the president of the Velingro Group, as well as trustee of the Tamilisai Sangam. The co-chair of this committee is Professor T. Murugavel. He is the head of the Department of Humanities and Social Sciences at SVCE, and must appreciate him for the good work he does in putting together the points that we put forth to our guests in each one of our sessions. The other members of the committee are Mr. Vinod Solomon, who represents the Secretariat in SICCI. He and his team have been doing an excellent job in putting these events together. Mr. Gokul Santanan, who is the Senior Vice President at Emphasis. He is responsible for the marketing collateral as well as marketing efforts of the SICCI-360 series. Mr. Amalan Alavandar, who is the Environment Consultant at Asian Development Bank, is responsible for monitoring the online chat session and feeding the questions to us for being answered during the course of this program. And of course, Ms. Vilasni M. Arun, who is a student of clinical psychology. We would also like to share with you, friends, that the next session of SICCI-360 is already scheduled. This is session 11. It is going to be with Dr. Mrs. Meena Muthaya, another very eminent personality. She is the secretary and correspondent of Chettinad Vidyashram.
Education.
Yes. And she's also founder of the Kumarani Meena Muthaya College of Arts and Science, as well as Kumarani Meena Muthaya Matriculation Higher Secondary School. This is scheduled for Thursday, the 12th of August at 4 p.m. And this is going to be held online. Well, please mark your calendars and do certainly join us. Dr. Reddy, thank you very much again for joining us. We greatly appreciate the inputs that you've shared with us today.
Let's make Apollo India as major healthcare destination for the world.
Thank you very much, and we would also like to extend a warm thank you to each of our audience today for participating with us, and looking forward to your ongoing participation with us in our programs. Thank you. Nandri, Vanakkam.